Dr. Corradino, this is going to be your second time in Israel and first time having a workshop out here. It's going to be something new for a lot of people. So let's start with tell us about yourself and what is neuropuncture?
Well, thank you, first of all, very much, Eli, for giving me this opportunity to be able to reintroduce myself to Israel. I'm very excited to be returning to Israel. It's been several years since I was there, and there's been some incredible leaps and changes and evolutions, not only just in the acupuncture profession, but definitely in the neuropuncture organization. So I think we could probably start by explaining what neuropuncture is for those of you that are completely new to hearing this. And what neuropuncture is neuropuncture is a complete neuroscience acupuncture system created by a classically trained acupuncturist for the classically trained acupuncturist. And what we do is it teaches the acupuncturist how to neuromodulate their patient's nervous system back into health using electrical acupuncture. Now, we always pride ourselves that this does not take anything away from the classical acupuncture theory. It really does not devalue acupuncture. With this, I believe what it does is it empowers the acupuncturist and our profession to clearly explain how acupuncture works, its neurophysiological mechanisms. But even more importantly, we can not only communicate better with our patients and healthcare providers, but we also have abilities to harness those neurophysiological mechanisms of acupuncture and then apply them in clinical settings to really benefit our patients. Something that I'm really excited about that was not available when I first went to Israel was how the organization has grown. We now have about 7 international instructors that are around the world teaching neuropuncture. We have now a level 1 clinical neuropuncture certification program that teaches the practitioner how to use electroacupuncture devices to treat internal medicine cases, pain and orthopedic cases, and mental health cases. We also now have an instructor program so we can train practitioners that are committed and devoted and that understand and comprehend neuropuncture, but also can also provide that treatment and be able to teach that to communities that we can't get to. And then on top of that, our organization has also grown now to offer a fully accredited internationally doctorate degree in neuroscience acupuncture. And I think that's going to really just help our profession get catapulted into the 21st century medical world by understanding that acupuncture is neuroscience. And, it's interesting, Eli, because we could even see that in the Ling Shu. And when I'm there in Israel, we're going to be talking about that at the workshops. I'm very excited to get into that.
Okay, maybe I can't wait for the workshop and to hear some more, but maybe you can elaborate a little bit more about the connections between what we see in the Ling Shu and the modern science.
Absolutely. Thank you. So, one thing is what I find a little bit, I guess I could say entertaining, is that if we look back at the books, the textbooks that come from China that I know I was trained in those textbooks, it actually also does explain the neuroanatomy of the actual acupuncture node. We call them nodes, the location and the actual area of that acupuncture point, right? They talk about the neurovascular connections of those nodes, right? So first, we can see that simply in the textbooks that come right out of China. But more importantly, some of our professionals or our practitioners are not really familiar with what book is the first book that acupuncture is mentioned in, what date that book was really written in. And when you go into the history of it, you'll really find out that the Ling Shu was written obviously in China. That's the first book where acupuncture is mentioned. And we have a time frame of where that was comprised or composed, okay? And that timeline really does mirror and really does resonate with the historical global evolution of medicine throughout time. And what we look at and what we see is that the entire world had an understanding that there was something very special in the air. We can't see it, but there's something very special. And when we inhale, it gives the body vitality. Okay. Now that goes back from ancient Egypt all the way up until the 1600s AD, until they understood how the molecular valves of the vascular system work. And they were better to understand how the circulatory system worked and how oxygen got distributed throughout the body. Now, I'm not saying that chi is oxygen, okay? Chi is a complex word, and it really is defined by the context in which the chi word or that kanji is in, right? So, but in that reference, we can see that from ancient Egypt, ancient Aramaic with prana, ancient Greece and ancient Rome using the word pneuma, and they all believe that. So when you go back into the Ling Shu and read that, right, you'll start to see that they were looking at anatomical structures. And I'm going to give you an example. In chapter 1 of the Ling Shu, chapter 1, they talk about where can we find the acupuncture, we call them neurovascular nodes, okay? And they specifically tell the reader that the acu nodes, and this is what I do when I read the Ling Shu, I cross out where it says points and I put node, because all of the physicians that studied acupuncture since the 1600s used the medical lens that they were trained in to translate the Ling Shu and understand acupuncture. And when all those physicians that were trained in medicine went back to read a medical classic text, they used medical terminology. So the acupuncture point was neurovascular node. The Jinglos and Mais were pathways, networks, channels, okay? And Qi was vital prayer or vital breath, okay? Now, when you look at the Ling Shu, chapter 1, it says the acu nodes are not found in the skin, muscle, tendon, bone. Skin, muscle, tendon, bone. Well, listen, if anyone's trained in medicine, think about this, even 2,000 years ago, even hunters, right? When we harvest our kill, we're going to look at the anatomical structures. And it is clear, I'm telling you, anyone that's done any human cadaver work, there are easy structures we can identify. Skin, muscle, tendon, bone, of course. But they're missing 2 other ones that are easily identifiable: the vascular structures and the nerves. And the fact that they did not mention the 2 very observable, gross, large tissues, nerves and arteries, to me, simple deduction will tell you that's what they were talking about. So when you go back to the Ling Shu and you start to read about the different needles, the techniques that they use, you'll really understand that they were looking to communicate, modulate the circulatory system of blood circulation, and definitely communicating with the nervous system.
Wow, thank you for your answer. That's really fascinating.
We have another one. I can bring up another one too. That's really exciting.
Oh, okay.
This has to do with Huatou, right? So when was first of all, we all know the Huatou Jiaji points, right? Obviously, we all are very familiar with those. And who found those or created those or discovered those was Huatou, right? The surgeon. From what time frame was this? We have to know the time frames, right? So we could put this in context. Well, Huatou was around 180 AD. And he was what? A master surgeon. He was a surgeon. So like everything I just said about understanding tissues and different anatomical structures, he was very, very keen to, right? He was a surgeon. He was actually known to dissect or remove diseased tissues in the intestines, stitch the tissues back, and then stitch the patient back up and not have any infection. That happens today. They have sepsis with abdominal surgeries, and he was able to do this 180 AD. Now, when we look at the back shu points, which were the classical Huatou Jiaji points, were the classical back shu points, what are the functions of those back shu points? Well, they were always classical points to do what? To modulate organ function, okay? Now, Huatou being a surgeon, now we know this, and illustrate this in my work. We illustrate this at the cadaver labs. We can dissect, and I've done this countless times. We can dissect and look at the dorsal rami. The dorsal rami are the nerves that exit the spine, right? We have 31 pairs of exit spinal nerves. One of those little nerves, they branch up, they become the dorsal rami. And those dorsal rami nerves come up and they create the back shu, or excuse me, the huato jiaji, the back shu, and then the outer back shu points. There's actually these little nerves that come right out of the spine. And what was beautiful is that Huato, being a surgeon, knew that those were the nerves he was needling and he was stimulating, and he discovered or decided, which was really, I think, very, very powerful and incredible thought at that time, to use a needle to stimulate those nerves. And he couldn't see the molecular reflexes that we know now exist in the spine, which are the muscular, visceral, and cutaneous visceral reflex. But when you needle into those little regions, that modulates the organ reflex in the spinal cord and then modulates the organ function in the organ. So that's another clear example of another wonderful surgeon, Huato, creating the back shu points, and they are completely neuroanatomical, and they completely do communicate with the reflex that does modulate organ function. And it's beautiful when we can look at acupuncture like that, and then look at our patient's nervous system and how to correct it by inserting little needles. And then we like to use electroacupuncture to really help express gene expression and really help to maintain those neuroplastic changes. Electroacupuncture has been shown to be superior. So we use those.
Okay, so yeah, jumping to the 21st century, that sounds like a great modality and lens to look at, but I can't not see the similarity of it connecting with stuff like vagal stimulators and stuff like that. Can you elaborate more about the difference, or what we do that is different from it?
Yes, thank you so much for bringing that up, Eli. So something that you're bringing up right now is something that we've been doing in neuropuncture for many years now. We have several vagal nerve stimulation techniques, and we have even other specific nerve stimulation techniques like the stellate ganglion technique. So in neuropuncture, we call it a complete neuroscience acupuncture system because we have a full body system, we have a full auricular system, and a full scalp system where we're using electroacupuncture on the ears, the scalp, and the body to communicate with the brain and specific receptors or regions of the brain to neuromodulate, neuroregulate, or neurorehabilitate them back into health. Now, the vagus nerve, what's beautiful about this is there's some very powerful research, and this is what I'll be teaching in Israel, on how to directly communicate with the deep central projections of the vagus nerve that enter the brainstem. And we can modulate the autonomic nervous system directly with that type of strategy. And what's really interesting is what we're finding is that the impact and the clinical applications of that are so wide, from mental health like PTSD to cardiology like atrial fibrillation to seizures like epilepsy to even conditions like long COVID. So just a lot of applications. And I think what's powerful about what we do and what we offer is, we use, a package of needles and a device like this. And we can, again, treat internal medicine, mental health, pain, orthopedic conditions, where Western medicine, when they use a lot of neuromodulating techniques, they usually have to do surgical implantations. So sometimes they'll do like a surgery and implant a chip and attach it to the vagus nerve, or attach it to the phrenic nerve, or attach it to the stellate ganglion nerve. We don't have to do that. Or even in the brain, right? They do deep brain stimulators. We don't have to do that. We can just place our needles at the proper location with the proper dosage and have a tremendous impact on the nervous system.
Okay, thank you. And
you're welcome.
You were talking about Neuropuncture as a global organization. Is there anything, any research done global wide, or anything that is that the organization does except treating people as individuals?
Yes, Eli. So one of the things I'm really proud that our organization is doing is with that doctorate in neuroscience acupuncture, we are all producing incredible research and data collection from the neuropuncture prescriptions. And this is being done around the world because we do have an international organization and we have instructors around the world, and my instructors are all going through the program, and we have other practitioners that are completing the work. And right now we're seeing projects being completed in Parkinson's, so neurodegenerative diseases, major depressive disorder for depression. We have a TBI and concussions. We have memory loss due to post-traumatic injury, so post-traumatic amnesia. We're also doing chemotherapeutic induced insomnia. All of these conditions, we're doing case report studies on them with patients, and we're all using the neuropuncture prescriptions. And what it is showing is that using this style of acupuncture, applying neuroscience to the classical model, using research-supported neuromodulating prescriptions and dosages, we're being able to produce now reproducible clinical outcomes with a prescription that we're very confident in now, where we're getting improvements of, like, I'm not kidding around, 65% on an average, right? 95% at the maximum, like really very, very incredible outcomes that I'm very proud of that we are seeing. And I believe that is going to change the acupuncture profession, because now the world and the patients and the global medical market will be confident in referring patients to acupuncture, knowing that it's science-based, that it's neuroscience-based. And I do want to say just one quick little thing on anyone that is, I know, really attached to the energetic model. I understand that. And I'm not saying that that's bad. I'm not saying that that's bad. All I'm just want you to just open up your mind and your heart to is that George Sully de Morant, the creator of the energetic model, he, first of all, was not a physician. He was a bank clerk. And he admitted that he created those terms to teach non-physicians. We are in the medical profession, guys. We're in the global medical world. Okay. I know physician's a difficult word to call people, and doctor gets a title that people get confused with. You know, if you have an accredited doctorate degree, that's why people refer to you as doctor. And I know that the acupuncture profession is under the umbrella of medicine. And George Sully de Morant was a bank clerk, and he created that terminology of meridian, point, and energy to teach acupuncture to non-physicians. And he was quoted on his deathbed stating that he agreed, he believed he made a mistake by using those terms, meridian and energy. So when you think about that, you know, and listen, I'm also very happy that that happened. Why am I happy that happened? That kept acupuncture in the limelight of medicine all through what? The 70s, 80s, 90s, very big. It created CAM, you know, complementary alternative medicine, integrated medicine. Hospitals were taking acupuncture. Never before was that being done. So I'm happy that that happened. But now there's that evolution, and now we can really step in the limelight with this proud honor, knowing that this badge that we wear is of neuroscience. And there's a lot of research to support that.
Yeah, that's interesting. I really wonder who asked Soledad de Morant on his deathbed that question. But yeah, that's super interesting, and we're lucky to have this knowledge pass through and come into the West in any way, and now we're enjoying it in a different lens and view.
Absolutely.
Dr. Corradino, what is your favorite prescription?
Oh, geez. I mean, something simple, right? Just something simple. Yin Tong to do 20. Nice and simple. What we do in the neuropuncture system, when we needle, right? The idea is to maximize the surface area of the acupuncture node, right? So when we're needling yin tong, I want to get like that much of the needle underneath the surface, right on top of my bone right there. And same thing with the yin tong. I got a great head to show that, but you just want to get like a nice little piece of that in the subaponeurotic space. Put that needle right there. You want to get a nice surface area of the node covered. Okay. So when you put a needle here and a needle here, and we insert it and thread it in, clip it on with our leads like so with these guys, right? And then we could simply we use the Pantheon, and I'll be discussing this when I get to Israel. There's different models that I'll be bringing to demonstrate, and we could have some shipped over for you guys. It is extremely accurate, these devices. They are extremely reliable. They're used in all of our research projects, and they're FDA approved. And that's important. There's a lot of devices that are not FDA approved that are sold to acupuncturists, and that's not only illegal, but it's dangerous. These are all FDA approved, okay? So what we do, Yin Tong and Do 20, this is one of my first prescriptions many years ago. Simply 2 hertz millicurrent, and that would be on a continuous mode, just number 2, and then in the millicurrent outlet. And what 2 hertz represents, check this out. 2 hertz represents just simply like lifting and thrusting. That's what the nervous system sees from that. So anytime we were doing 2 hertz or lifting and thrusting on these body points, there's actually a couple receptors that are being targeted. And when we do 2 hertz on simply Yin Tong and Do 20, beautiful chemistry and neurochemistry gets released. We have the D1 dopamine receptors from the prefrontal cortex getting activated, the 5-HTP receptor of the hypothalamus being activated, and BDNF and GDNF being produced, brain derivative neurotropic factors and glial cell line neurotropic factors. Both of those are so important for brain health. So when you hear me saying dopamine and serotonin, you could probably start to put together, yes, good for depression, good for maybe a little bit of even PTSD, someone that has any type of TBI. And again, the strength of the intensity doesn't have to be too strong. You always want it to be comfortably strong. So nothing painful, nothing sharp. A dull tapping is great. So simply Yin Tong, Do 20, 2 hertz, nice and easy. And you just keep that nice and light for about like 20 minutes. And that's really nice for the brain.
So thank you very much, Dr. Corradino, for sharing this knowledge with us. I can't wait to see you in the workshop in Israel on May. Yeah, so thank you very much.
Well, thank you, Eli. And we'll be doing this once a week. So we'll be giving some nice information out on neuropuncture. We'll be talking about some different medical topics and different clinical strategies. So thank you so much. Really looking forward to coming out to Israel. You guys have a great day. Talk to you soon. Ciao, ciao.